Good morning, this is Dr. Fletcher with your Monday Motivation. March is National Nutrition Month, so we wanted to take some time this month and focus a little bit more in on nutrition. There is a huge problem around the globe with nutrient deficiencies. And unfortunately, some of these we call kind of hidden hunger because the apparent signs of the nutrient deficiency aren't really obvious. We are an overfed and undernourished nation. We eat a lot of food that's really not full of a lot of nutrients. But there are many other reasons why people are low in specific nutrients, possibly due to access to certain foods, malabsorption, surgery, or medications. One of the key nutrients I want to talk about today is B12. So B12 is a very important vitamin. It's an important nutrient involved in many enzymatic and metabolic processes throughout the body. It helps with formation of cells, with nerve tissue, and it just plays such a critical role. And unfortunately, many people are very low in B12. One of the top reasons that people are low in B12 is because we physicians actually create that problem for them by giving them medications that depletes their B12. In fact, of the top 8 prescribed drugs in this country, 2 of them, metformin, which is used for diabetes, and proton pump inhibitors such as Prilosec, one of the common side effects of these drugs is that they lower your B12. So it's not always that you're maybe a vegan or vegetarian and opting not to eat the foods high in B12, such as meat, red meat, or eggs, but it may be in fact due to something such as simple as the medication that you're taking. Other risk factors for low B12 include gastric surgery, advancing age. People over the age of 60 have a higher incidence of B12, and certainly poor access to food, and then people who have poor absorption issues such as inflammatory bowel disease or celiac. Symptoms of low B12 can be kind of non-specific, fatigue, tingling in the extremities. Common that we rarely actually see but is commonly reported is a glossy tongue. It's called microglossia. Some people have some cognitive or foggy thinking. And if it progresses, it can actually lead to longer chronic health term problems. The one thing that always surprises me, well, it shouldn't now, is that when people see us, they're like, oh, I'm sure my doctor checked me for B12 deficiency. Unfortunately, it is not part of the common labs that you get when you go in with your primary care. So if you're experiencing these symptoms, you're taking one of these medications, which again, a lot of people are on these meds, maybe your diet's low in those types of nutrients, ask your doctor to check your B12 level. You should check a serum B12 level. You can also check a test called the MMA, methylmalonic acid, which reflects absorption. And then in certain cases, something called intrinsic factor antibody, which relates to an autoimmune form of B12 deficiency. If your B12 is low, it's easy to replace it with these foods if you can incorporate them, or specific supplements. I have some examples here. One is a dissolving B12. This one actually includes folate. It places under the tongue. It goes straight through the mouth and mucous membranes, which ups your absorption. If you're swallowing it and then the absorption issues in your stomach, this bypasses the problem. The other is something we call methyl assist, which has specific forms of B vitamins. And then finally, for some people that actually, unfortunately, need to do B12 shots. So B12, again, an important mineral, an important vitamin that's very important in many processes in your body. Not commonly checked, something you need to be aware of. And as we focus on Nutrition Month, something to think about checking if you're experiencing any of those symptoms. Have a good week.